Now with a report on breast cancer, here's our reporter, Laura Windsor.
A breast cancer diagnosis is life-changing, but the earlier it's detected, the better the outcome, even a cure. We spoke with Dr. Swarna Chanduri of Pomona Valley Hospital Medical Center to learn the early warning signs of breast cancer.
The earliest breast cancer, usually we don't have any symptoms. And we won't feel a lump, we won't feel any skin changes, and we won't feel anything, no blood coming out or anything. So I think most of the time the women, we want the breast cancer to be detected early when there are no symptoms. We diagnose it by screening mammograms. Mammograms is an X-ray technique which can show if there are any abnormal calcifications, meaning some white spots, or if there is any kind of shadowing or any masses inside. These are detected very early by X-ray. We can't even feel. By the time we can feel a lump, it's already a 2 centimeter mass. And we don't want that, and that's the best way of picking up is by mammograms. And in the mammograms also, there are some film mammograms, digital mammograms, and recently we have this 3D mammography or tomosynthesis. The advantage of that is it can detect what the mammograms cannot detect. 30% of the time the mammograms may not be able to detect some lumps, but this 3D mammography can detect it. It picks up cancers or the lesions much more accurately. And then the radiologist will say, okay, there are some abnormalities and maybe these are cancerous or no, we don't know. And then we suggest, let's do a biopsy. We do ultrasounds also to see if these lesions are water-filled or solid. Water-filled ultrasound can pick up, and then the biopsy. And from there only we'll know, finally the pathologist will tell us, actually looking at those slides, whether this is cancerous or a benign condition. The pathologist can these days tell us that some cancer cells, they need female hormone like estrogen and progesterone for them to grow. If that is the case, we call them they are hormone sensitive cancers. And these are the types of cancers we can treat them by blocking those estrogens, by giving anti-estrogen medications. The attractive thing about this is these are all pills and the side effects are very minimal. Most of them, they won't have any hair loss or won't have the side effects of like chemotherapy.
The doctor recommends certain age groups have yearly mammograms.
The American Cancer Society recommends every woman should have a mammogram from age 40 onwards. There are some women who are high risk, and these are the women who have a family history of breast cancer, or if they have dense breasts, or if they feel lumps or had biopsies before. These are the women, they may have to be screened early from age 35 onwards. And after 50, every society recommends that women should get screening mammograms every year until 65. The survival rates are really good if they are detected early. It depends upon the stage. If we detect the cancer very early as a stage 1 cancer, that means when the cancer is just confined to the breast itself and didn't spread anywhere, we can, with the proper treatment, almost like 95% of the women can be saved.
It's vital to get regular screenings for your peace of mind, but also to catch problems early. For the American Health Journal, I'm Laura Windsor.